Good afternoon, Malaysia. Welcome to the Lim Ren En live show. We are back with another great interview today. Our guest this week is Dr. Naresh Govindarajanthran of Sunway Medical Center, a small town boy who determined to make it in life. Son of a teacher and from an ordinary middle class family, he knew that the only way for him to be a medical doctor, it is to do it the hard way. Today we have Dr. Rajendran with us, who spent his early childhood and also his secondary school life in boarding school and survived the hardship of a regimental life in a boarding school and made it to one of the very few top vascular surgeon in Malaysia. So Dr. Naresh will talk about the management of diabetic foot at the later part of the show, and you can actually ask questions in between shows to Dr. Naresh about diabetic foot or about his story of being a successful person. So now let us put our hands together and welcome Dr. Naresh. Hi, good afternoon, Dr. Naresh. How are you, sir?
I'm good. How are you, Ren?
I am very fine. You know, it's such a privilege to have you here with us today. And when I put out your poster on Thursday, I've got friends from KK, you know, Dr. Chia, who called KK and asked me, how do you know Dr. Naresh? How did you get him on your show? You know, and I believe when your poster was up on Thursday, you got like what, 35, 40 calls already?
Some people asking me, yes.
Some people asking me, huh? Now, Dr. Naresh is a top surgeon, a vascular surgeon from Sunway Medical Center. He used to serve the country for many years, Dr. Naresh, right? You used to serve the country for 15, 20 years before he turned private. So we would love to know about you, Dr. Naresh. I know you have an amazing childhood life. Let us talk about that, right? We want to know your struggle to be who you are and your focus to be a surgeon. All right? So tell us a bit of yourself, Dr. Naresh. Where are you from and your family?
Okay. I grew up in this little town called Batu Arang. Batu Arang is a small town which is near Rawang. It's one of the old coal mining fields during the colonial times, and then since the 1930s, it stopped functioning as a coal mining town, and it became just a normal small town. So I grew up there. My father was a teacher there, and my whole primary school was there. And it's a very nice little quaint town, easy to move around. Everybody knows everybody. The typical small town kind of thing. Everybody knows my father, my mother, and all. So I grew up there. Then after completing my primary school, then I went to a boarding school. I went to Sekolah Menengah Sains Selangor. That's in KL. That's opposite HUKM. And I spent another 5 years there in a boarding school. Boarding schools are different. You live there. You basically live a regimental life. You get up early in the morning, you take care of yourself. At the age of 13, so you're out on your own, you take care of yourself, your own food, your own clothes, you make your own bed, and everything is done by yourself. So, but it disciplines you. It makes you a very disciplined person from the beginning itself. It teaches you a lot of things in life.
Now, Dr. Naresh, you are from a middle-class family. Your father is a teacher, a government servant, and your mom, you're saying is a stay-home mom, right?
Yep.
Now, what makes you decide to pursue medicine at a young age? You know, you could have done so many other things.
I don't know. I mean, there's nothing in particular that made me want to do medicine. I think it's one of those things that you realize that it's nice to be able to help people. I mean, medicine is something where you do it because you're passionate about what you're doing, and so you end up doing it because you look at how people you want to help people. You want to see what you can do to reduce people's ailments and to help them with their health conditions and all. And you when you look at that, you get it. You get inspired to do it, and you go on to do it. And it's what I tell everybody, whoever wants to do medicine. I think it's not so much of it's work, a lot of work, but it's mainly the passion. You need to really want to do it, and don't ever do medicine because somebody asks you to do it. Don't feel pressured to doing it. Don't get somebody to tell you, no, you got to do medicine because that's what everybody should do, or you can earn a lot of money and things like that. Don't look at that. I mean, don't get pressured. A lot of people get pressured by maybe even their parents, their siblings, their relatives to say, oh, you should do medicine, and they end up doing medicine not because they want to do it, because somebody told them to do it. Don't ever do it because you want to do it. Yeah, I think that's it.
So your advice to the young guy is to do it if you really want to do it. Don't do it because your mother asked you to do it.
Yeah, don't do it. There are a lot of things you can do. Your mother asks you to tell you, or your mother asks you to do medicine, don't do.
I'm from UKM. Actually, we went to the same college, Naresh and me went to the same college, College Tun Dr. Ismail.
Yes.
One of the most beautiful college you can go to in KL. Right in the smack of KL at Titi Wangsa. It's a lovely place, right?
It's a beautiful place.
It's a lovely place to court your girlfriend, actually.
Beautiful scenery in the middle of the city.
It's a beautiful scenery in the middle of the city. So I'm an alumni of UKM. Dr. Naresh is an alumni of UKM. I knew about this when we met. Only after we know each other that we are alumni from the same college. My wife is also alumni of UKM. So now, you had an interesting story. We would like to know about that middle school kind of thing. Your Sekolah Kebangsaan Sains Selangor, that regimental life, that boarding school life. Tell us more about that. Not many people have gone through a boarding school. And I hear from you there's only 10 non-Muslims and non-Malays goes to this kind of boarding school. And you are the cream of the crop that actually be able to be part of it. Tell us about this boarding school. How's the life inside a boarding school?
Okay, I went to Sekolah Menengah Sains Selangor. That's one of the what was termed as, or still termed as, the Sekolah Berasrama Penuh, SBPs, or the National Boarding Schools here. All the schools are fully boarding schools, which means that there's nobody who lives outside. Everybody stays in the school, in the hospital, in the school itself. My school was a co-ed school. We all enter at Form 1, so the age of 13 we are there, and most of us will be there from Form 1 right up to Form 5. Okay, typical starts at about 6. We get up in the morning, we have a shower, we make our own beds, and then we go to, we have our breakfast, then we come up to we have a breakfast in the dining hall, and then we come up to our rooms, and where there's inspection. So the prefects will come, they'll inspect our beds, make sure our beds are made, our uniform is all correct, shoes are polished, because we all wear black leather shoes in school.
Wow.
Normal uniform, but black leather shoes, that's standard, so all polished now. So then we go to class, class starts at about 7:30, goes up to about 2 o'clock lunch, we come back, the Muslim guys go and pray. 3 o'clock we are back in class again. 3 to 4:30. 3 to 4:30 we have something called prep hours where we do our homework and stuff like that. 4:30 back up, tea. 5:15 down on the field. Everybody is compulsory to go to the field and play. You always have our own games and all that. I used to play cricket, play a lot of cricket before. And we'll be from 5:15 right up to about 6:30 in the 6:45 up again, 7 o'clock. We'll get ready for our dinner. Dinner's at 7:30. Then after the Muslims go and pray, 8 o'clock we are back in class. And we wear normal clothes, 8 o'clock till about 10:30 at night, where we do our schoolwork, we do our homework, and we sit in class, and we don't have teachers, but there are other prefects taking care of us and all those things. 10:30, we are back in our rooms, we get ready for bed. 10:45 or 11, I think lights out every day.
Now, every day, and you are telling me this is like Monday to Sunday.
Monday till Friday. Saturdays, we don't have afternoon prep and night prep. So Saturdays we can watch TV. There are two TVs in the school, and all 600 hours, 500 hours probably. Yeah, about 500 hours share one TV, two TVs. One for the girls, one for the boys. So there's no TV. We don't watch TV.
Just imagine this. All the audience, can you listen? This is a regimental boarding school that he went through, that you have to be in class probably like 10 hours a day. Morning, afternoon, and night.
But you spend a lot of time you spend a lot of time with your friends in class. You do your homework. After you finish your homework, you study, or you read other things. You're allowed to read like newspapers. You're allowed to read books, but not comics and things like that. But yeah, and you spend time maybe in the computer class, or even computer room, or even in the library and things like that. So yeah, it's okay. Get used to it.
A lot of your good friends are up watching you, like Dr. Kama Palani, Nisha Devi. I think it's your sister, right?
Yeah, it's just my sister.
So your sister have a question for you. So I'll just pick up this question and ask you right now. Nisha is asking, how was boarding school shape you to the individual you are today?
I think it makes you a disciplined person, and because at a very young age, you are made to be responsible for yourself. You take responsibility in everything about yourself. Nobody takes you basically take care of yourself, and because of the hours that's there, I always wake up early in the morning. I never get up late. I always get up at 6:30, even on Sundays and all, because it's ingrained in you. Your body clock is such that you do that every time, and you also keep the time. You are punctual most of the time because you were taught to be punctual. In school, 7:30 you're supposed to go to class. 7:30, 2 o'clock you're done with class. You gotta be on time for everything. You cannot be late, because then you get in trouble with the school wardens, and that's a big problem. So that makes you a better person. I think it made you a better person, and you see you're a very disciplined person. I think that's how it helps.
So actually, boarding school is actually quite good for you, right? In shaping you as a person.
Yeah, I think boarding school is good, provided you have the good influences. Boarding school can work both ways.
Mm-hmm.
It can give you good, can influence you well, or it can go the other way. It depends very much on the person, and depends on the surroundings. A lot of factors that affect the person. You can learn. You can pick up the good things like what I've mentioned earlier on. You can pick up the bad things like boarding schools have issues with discipline. There are also issues with kids smoking, illicit drugs, and sometimes occasionally. So there are issues with it. They're not common, but there's always that possibility also. So it can work both ways.
Now, there's this prevalent issue that we understand from boarding school. I was never in a boarding school. I was a bit lucky. I was never in a boarding school. I should be in the boarding school. I should send my son to the boarding school, right? Since you go through that regimental life of boarding school, and Nisha was saying here, I can vouch that you are the most disciplined out of the 3 siblings, living an amazing example in life. So your sister loves you so much, huh? Of course, sibling loves us, huh? So just want to check with you. We went through that regimental life in school, in Form 1 to Form 5. Then Form 6 was a easier life for you because you went to a normal school.
Yeah, Form 3 I went to Sekolah Kapong, a normal school.
Now tell us about your life in UKM. You got good grades and you went to UKM. And I heard during your time, the ragging of the UKM medical faculty is pretty bad. Tell us a little bit about that.
I think it used to happen yeah, for years. Like I mean, and I think it's to me when I was ragging was going on UCAM, it was not. I mean, it's not very bad to me because I came from a boarding school and things that happened in boarding school are a lot worse compared to what happened in UCAM. Right? It's hardly anything. I mean, the ragging in medical school goes on for maybe a week or 2 weeks. Boarding school, you're being bullied for a good Form 1 to Form 2 for a good 2 years, 2 whole years you get bullied. So this is nothing. But ragging, okay, at one point ragging teaches you certain things. There are people who teaches you to be humble to a certain extent sometimes. It also long-term wise, the guys who ragged me eventually became my very good friends. I mean, they're basically my seniors until today. These are the guys who are all in the field, who are all doctors. Most of them are specialists in their own rights, in their own fields. They're all experts in their own fields. And these are the guys who are now there, and they're all a phone call away. These are the guys who rag me. So if I need a cardiologist to help me, I just pick up a phone call and say, "Remember me?" Yeah, they remember me. Just pick up. And these guys, if I need help for a patient of mine, one phone call, I got orthopedic surgeons, cardiologists, all fields. And so in medical school, these guys who drag you, who are the ones who will be your friends for the rest of your life. So yeah, I think dragging. I mean, as long as you don't take it too far, as long as you take it, ragging gets it helps you get to know a person. It helps helps the junior to become more humble and to know what's in it for him, and eventually actually they help you out. All these chaps who drag you will be things will help you out throughout your journey in medical school, because when you're in first year of medical school, you're not sure how to do things, how the exams are going to be, what is expected of you. They have to give you books and give you notes, they tell you what to expect and things like that. So it helps you quite a bit.
So basically, I went through UCAM ragging. Now, my ragging, if you calculate the scale 1 to 10 compared to you, is like maybe 0.5, 0.5. My ragging for a week, and we thought of complaining to the school already, but hearing you gonna rag for 2 years is, nothing. But that actually builds character, right? In a lot of ways, it builds character, it builds the teamwork, it builds closeness within people. But it's just that a lot of time parents seems to be a bit more protective of their children. They're a bit worried. So I went through the UKM ragging first week, but it's fine. Nothing happens. After that, you become good friends, all the seniors.
Is that sometimes people take it too far. I mean, there are guys who know when to stop and what's orientation, what's ragging, and what's pushing it too far. I mean, if the person gets physical and all those things, then that's a point too far. So that's in university it's not so bad because people they are already adults. In medical in boarding school they're not. They're teenagers. Teenagers don't know when to stop sometimes. So it becomes a bit push things a bit further than it should have.
Of course. I totally agree with you. So let's talk about today, the subtopic that we're going to talk about. Today's main topic is you. A lot of people thought today's main topic is about medical. No, today's main topic is Dr. Naresh. We're going to listen to that guy, the amazing story behind his struggle and came out the way he is. Now, so let's go to the subtopic of diabetic foot. That is your field, your specialty on diabetic foot. So tell us a bit of this. What is this, Dr. Naresh? CVD, CAD, and PAD.
Okay, there are three different things. I mean, what I treat, I'm a vascular surgeon, so I treat problems with the vessels. The general thing I treat is peripheral arterial disease, which is a part of diabetic foot. PAD means peripheral arterial disease. And it's what I'm trying to show is that these three things, it's PAD, peripheral arterial disease, CAD, coronary artery disease, and CVD, cerebral vascular disease, they are all interlinked. They are all actually part of the body's arterial system. So people with PVD, PAD or PVD can get diabetic foot, get gangrene of the leg, and they can lose the leg. They may also have coronary artery disease, for which they can get anginas, ischemic heart disease, which means chest pain and things like that, or heart attacks or myocardial infarction. They may also develop narrowing in the vessels in the neck or the brain, and they can have cerebrovascular disease, which means they may end up with strokes. So anybody who has got peripheral arterial disease, who's got diabetic foot and blockage of the arteries in the leg, should get their heart checked up also. So they need to have like an ECG done. They need to have they may need to be seen by cardiologists, their cardiac workup done, and vice versa. So anybody who's had a heart attack or has had some heart angina and things like that should have their leg pulses felt. Look at their feet itself, especially if they're diabetic. And especially risk factors. And risk factors would be people who smoke, hypertensive, diabetics, family history of ischemic heart disease, being a male, and all those things. Those are the risk factors. If anybody's got all these risk factors, then they should get themselves checked out.
So can I just check with you? Now, you are saying PAD, VAD. So if I look at this presentation, CAD means anything to do with the heart, CVD is anything to do with the head, and other parts is actually PAD is peripheral, right? So if you have a diabetic foot, you might want to get your heart checked out and everything other things checked out.
You need to get the heart checked out, yes.
That's correct. So tell us about the second thing. There's this picture with a sore toe.
I mean, one of the first things that happens in a person with diabetic foot is that as time goes by, a couple of things happen. Number one is that the nerve endings will die off, and they'll get numbness of the feet. So sometimes what happens is they will probably stub their toe somewhere, they'll hit something. Or another common thing is an ingrown toenail. They may have an ingrown toenail, or they may go and clip their toenails and clip it too much, and they don't feel pain because it's insensitive, it becomes numb. So that's one thing that happens. The second thing that happens is that because of their diabetes, their immunity goes down. They become immunocompromised, which means the immunity goes down. They can't fight infection as they would normally. And the third thing that happens is they have their blood vessels become narrowed. So with all these things on board, what happens is a person will have a minor injury. In normal times, what will happen is it will heal. Nothing happens to it because it will heal. They will be all right, and maybe just some pain for a while, maybe some mild infection, antibiotics, and okay. But in a person with diabetic foot, what happens is it will progress. It will not get better. So the infection progresses. The demand then becomes higher for blood because now you've got an infection on board and the infection is becoming worse. And because the arteries are narrowed, the demand cannot be met. There's not enough blood going down, not enough nutrients going down. It will not heal and it will progress. What then happens then is that the infection becomes worse, the infection starts ascending, and ascending means it goes higher. That means you start off with a toe, it goes up to the forefoot, it goes up to the ankle, and goes higher and higher. And the worst thing that can happen is that it will then go into the blood. Whatever infection goes into the blood. And when that happens, a person then there's a high chance of developing other complications like organ failure. They can go to renal impairment. They can go into renal failure, and a lot of other problems can happen. So that increases the mortality. Hence, it's very important. Number one is to prevent it. And number two, after prevention, the next thing to do is to treat it early if a person gets it. And get medical treatment early.
So that was a amazing glory kind of picture that one of your patients that had an infection from the toe right up to the thighs. What will happen to this guy? Will he amputate?
A lot of times, more often than not, the patients, sometimes, for one, they may go for treatment, then they get scared of what's the treatment going to be and all. So they tend to hope that it will go away. They'll hope that one day they'll wake up and wounds will heal and everything goes away, but it doesn't go away. It gets worse. And so by the time they reach us, a lot of times, sometimes you can't do very much. And what we do is to save their life. And the only way to save their life, take off the leg. So they end up with a major amputation. It's either a below knee amputation or an above knee amputation. So, you're seeing a patient like this, you're looking at a patient and say, okay, this patient has become very, very sick, and you want to do something for them. You want to save it as much as you can, but sometimes looking at it, the leg is going to kill the patient. So the only way is to take off what's going to kill the patient, take the leg off. It's very difficult to accept for a lot of people, but sometimes you've got no choice but to do that.
Mm-hmm.
The same thing is to prevent this from happening. I mean, if you get it treated early, this will never happen.
So you are saying that the other day when I talked to you, are saying that the management of diabetic foot in Malaysia compares to other countries. I think we still have a lot of room to grow, right? Can you tell us a bit of how it works in actually, say, Australia or in US? How does it work?
I think in a lot of the developed countries, the primary healthcare recognizes diabetic foot as a very big major problem. So patients probably, they know they get treated early. So what happens is that when they have first of all, a lot of these things are prevented. So number one, they take care of your sugars. There's something called HbA1c, which is the 3-monthly kind of 3-monthly look
Yep.
at the control.
Yep.
You want to get it to 7. So that's number one. Number two, you get them to all these patients need to exercise regularly, and that's the circulation going, and keeps the heart then healthy and all. The third thing that happens is the blood pressure control is very good. So you want to get the blood pressure to be like, for diabetics, you want them to be below 130/90. You want to get very tight control. You want to get patients to stop smoking. And all these countries have got the system where they are all these things are in place. So once this is all done, then you've got these patients who come regularly for checkups. So then they look at your feet itself. You'll have the Western countries have podiatrists. These podiatrists are guys which look at the feet itself. They will make sure there are no calluses, there's no hardening of the foot and things like that. They will make sure the toenails are properly cut. They will get them good footwear. So that means if they're diabetic, they'll have proper footwear which prevents pressure points in the foot. The pressure points in the foot are the reason why people develop ulcers and wounds in the leg and injuries to the leg. So they get proper, good footwear for themselves, and they're taught how to take care of themselves. Okay, so that's one. So that's prevention comes in, it's a big part in that. Then once a patient has got a diabetic foot ulcer, the next thing that happens is that they're treated very early. So there's, in a lot of these countries, a patient comes in and they're seen by a whole team. So you have got, you may have a foot and ankle specialist. Foot and ankle, there is an orthopedic specialist. You've got infectious disease doctor. You've got a vascular surgeon. You've got a wound care nurse. You've got a pharmacist and an endocrinologist. Very important. You may have so this patient will stay put, and all these doctors will come one by one and have a look at the patient, and the patient is then is treated by all these doctors. So everyone gives their input, and then the patient then gets the optimal treatment. So everything's taken care of. So from the sugar control to if there's any infection, if any food support's required, if the vascularity is a problem, the medication, so the pharmacy will look at through all the medication, make sure there's no interaction, and patient regularly takes the medication. So all these things are done properly, and only with that you can actually have a good diabetic foot program.
So now, Dr. Naresh, you're a vascular surgeon. Now, vascular surgeons mean you take care of, my understanding here, you take care of any blood vessel outside the heart, right? And the brain.
No, the brain, no. We take care of the arteries in the neck, which supply the brain, the carotid arteries.
Okay.
The ones in the brain are taken care of by the neurosurgeons.
So anything below the neck, not the heart, everything is yours.
Yes, everything, all the vessels
the whole
are.
body. So tell us, as a vascular surgeon, what is your role in treating a diabetic foot? Is it blood supply and all that?
A lot of times, one of the major problems with diabetic foot is that the lack of blood supply. Because diabetes itself causes changes in the blood vessels, and they get narrowed blood vessel or get it blocked. So if it's blocked, so then it comes to a vascular surgeon. And so one of the things that a doctor, when a person goes and sees a doctor with a diabetic foot, the first thing they feel are pulses. Traditionally, everybody will say the pulse is felt in the wrist, and you just feel a pulse there. As you can, there are lots of other places you can feel the pulse, in the neck and the leg, from the thigh, behind the knee, and in the foot itself. So doctors will then feel for the pulse, and if you don't feel the pulse, if there's no pulse, that means there's lack of blood supply, and that's the least they can do. Then they will refer to a vascular surgeon. A vascular surgeon will then assess the foot itself, and then will look at the vascularity of it. Because if you don't establish good blood supply, nothing will heal.
Mm-hmm.
And your wound will just progress, and it will become a problem. So that's why the role of a vascular surgeon is to re-establish blood supply. And we re-establish blood supply by various means, anything from medication to angiogram, angioplasty, stenting to bypasses. So the whole thing is done by vascular surgeons.
So in a way, if you have a diabetic foot and you are seeing a Chinese sincere and you're not taking care of the blood vessel problem with a vascular surgeon, you are not going to heal that foot, right?
It will never heal. It will never heal. I mean, that's one of the problems faced by patients in this country, because sometimes they get this infection in the foot, and nobody feels the pulse. Nobody actually knows whether there's enough blood supply. So you just pump them with antibiotics. They get. So they start off with one small little injury to the toe, so then they get some wound debridement. It gets you cut off a little bit. Then it progresses. Toe comes off. First toe comes off. Second toe comes off. Third toe comes off. Front of the foot comes off. Then it just progresses from part to part. Eventually, then the whole leg comes off, because nobody addressed the problem of the lack of blood supply. Nobody looked at it.
So if anybody who has a parent, listen to this. Those who guys you're listening, please share this out to friends who has diabetic foot or are diabetic. If you have any parents who has this problem, please solve their blood supply problem with the vascular surgeon first, right?
Yeah, I think you should you should actually get somebody to look at the vascularity. That means if a person is seeing a regular doctor, if you see the diabetic doctor, the diabetic doctor will feel the pulse and look at it. And then they will see a vascular surgeon to actually to assess the leg itself. If a person is seeing a GP, the GP should feel for the pulse and then refer accordingly.
Now, so the Sunway Medical Center has a sort of a system, right? A sort of a system that manages diabetic foot, and you started that. Tell us a bit about that. How does it work? How does it actually benefit the patients?
Sunway has got a team. In terms of support, Sunway is one of the few hospitals that have got like a podiatrist, an in-house podiatrist. Podiatrists basically looks at the feet itself. They look at the various problems with the feet. So look at formation of calluses. Calluses is the hardening of the skin. They look at footwear of a person. They look at the nails of a person, and also you've got a podiatrist. You've got a good dedicated wound care unit. The wound care unit run by the paramedics, mainly nurses, and they actually look at the various different aspects of the person develops a wound, and also they do all the dressing. And the type of dressing they use are all the modern, latest dressing that's available. And patients don't actually have to come in and stay and to be inpatient. They can come in as outpatient and get their treatment and all done. You've got a good foot and ankle surgeon who actually will look at foot deformity, correct it, all the various different things. Endocrinologists, pharmacists, vascular surgeons. So basically, you've got all the specialities required for a comprehensive treatment for a person in every way. And also, in the event that a person does end up with an amputation, there's also a very good rehab center with physiotherapists, a rehab physician, so to actually rehabilitate the person. Right. So you're looking at the processes, putting on prosthesis, and then getting the patient to start walking again. So if you have a patient with a below knee amputation, it may take some time for them to get rehab, but then here you have everything in house, so the patient will then get all the physiotherapy needed, strengthen the arm, and then get on to a false leg, and they can go back to their normal life again.
So basically, Sunway has one of the best centers for diabetic patients, including diabetic foot and butt. But as you say, right, I've got a question here by a few of your listeners. We'll try to answer them. As you say, right, it is better to prevent diabetic from going to that level. You know, instead of going through therapies and all that, you have to prevent that, right? So can you answer this question by Rangasamy? He says, we've got to know about diabetic that cause kidney failure. So diabetic will cause kidney failure at last. How true is it, and the timeline for it? You know, so what do you think?
There's no timeline as in, you say if a person develops diabetes and in 10 years they'll develop kidney failure. It doesn't work that way. What's more important is diabetic control. Nothing beats the control of diabetes. That means if a person who's been diagnosed with diabetes, they need to have proper control. They need to see their doctors, whether they're physicians or GPs or the endocrinologists and get proper. And the sugar control needs to be very tight. So they need to take care of their diet, need to exercise and need to lead a healthy life and get your sugar control good. With that, a person can be diabetic for years and will never develop renal failure or renal impairment. And you get a person who's been diagnosed with diabetes, and within 3 to 5 years they've developed kidney failure because they never took care of themselves. Diabetes itself has got a lot of complications. Can have a lot of complications if a person doesn't take care of it. So a person can develop kidney impairment, kidney failure, eventually kidney failure requiring dialysis. They can develop eye problems. They can develop something called retinopathy, which is problems with the retina of the eye, cataract. They can develop heart problems and also peripheral arterial disease and all. So there are lots of complications with diabetes if it's not taken care of. I mean, at the end of the day, it's sugar control and a healthy lifestyle. Nothing beats that.
That's good question. You know, good answer. My mom has 20 years. My mom is 78 and she has 20 years of diabetic, and she has not lost a single toe. She has not developed kidney failure.
Exactly.
She just did a cataract like maybe 2 years ago.
Yeah, exactly. A person can be diabetic for 20, 30 years and they are fine. They're okay. I think one of the problems with diabetes is that, especially among the younger people who are diagnosed with diabetes at a younger age, is acceptance. You can't accept the fact, a person can't accept the fact that they are diabetic. And hence they don't take care of themselves. They don't take the medication. They lead their normal life when they should be actually taking extra care for it. Yeah.
Now, one question from this lady, she asked about, what is your thought about mental health? Are you in the position to answer that question in youth? Mental health in youth.
I'm not as a doctor. I mean, it's important. I can say mental health is extremely important for everybody. Anything in particular in youth, I think the best person to ask, the prevalence and problems and all what type of problems, is best to ask a psychiatrist.
Best to ask a psychiatrist, huh? So another question, I think this is another doctor asking you from another doctor. A doctor asking a doctor. Dr. Naresh, how has COVID-19 changed the medical field?
Okay. Couple of things. Number one, a lot of us are a lot more careful with how we deal with patients.
Mm-hmm.
So when we face a patient, we look at things differently. A lot more precautions are done to a patient. So how it's changed is that the medical fraternity itself has become very, very careful about how things are. They are more aware of how infectious disease spread. Simplest example, hand washing. Hand washing is now such an integral part of our everyday lives, not only among medical personnel, but even a normal layperson. You come into a hospital, you'll find this alcohol rubs everywhere, and you'll find people doing it all the time.
Mm-hmm.
Actually, a very good habit. In the past, you go to a restaurant, you see somebody wiping down the table, and think, "Why is the guy keep wiping down the table? The alcohol rub and all." You don't think it's this, but actually, you can spread diseases. There are always things lurking everywhere. So, by hand washing among medical staff, among people who visit hospitals and all, what I've seen personally, what I've observed, and a lot of people have observed, is infection rates in hospitals have come down. A lot less hospital-acquired infection. In the past, if you have an elderly person or anybody enter a hospital beyond a week, there's always a high chance of them picking up some pneumonia, some infection or another. Now it's a lot less because I think it's the simple thing is just hand washing. You just take care of yourself, hygiene and care.
I heard old people will go into the hospital with one thing and then die with the other thing, which is what you call hospital infection.
Hospital-acquired infection, one of the highest causes of mortalities in the world. So you go visit a person, and then you see another person, or even a doctor who sees one patient and then goes to see another patient, and they may carry the germs from one patient to another person. But just by hand washing every time you touch a knob, you do anything, you see one patient, you do the hand rub and all. By doing that, you break whatever transmission of germs. So I think it's made us a lot more careful about things, a lot more vigilant in what we do. And I mean, that's the little silver lining of COVID-19.
So COVID-19 actually bring more good than bad, nah? No, not really. Also, not really.
That's bad.
The bad is still bad.
But it got us to think. I think it made us stop doing what we normally and re-examine how we do things. And I think it will make us stronger and better.
All right. So how's the side effect of diabetes medicine? So
diabetic.
This guy trying not to take his medicine.
No, I think all medication have got side effects. I mean, one of the it's not a side effect. One of the things about diabetic medication is that it can cause. I mean, one of the things if you're not careful when you take diabetic medicine is it can cause hypoglycemia. Hypoglycemia is that when the sugar drops too low. So if somebody is taking medication, you should actually see a doctor, get optimally treated by the doctor, and then make sure when you're taking, say, insulin and things that you have your meals. I mean, one of the important things about diabetic control is that not only medication, it's also food, your diet itself. A person should have the meals regularly and should have a healthy diet. I mean, anybody who's diabetic, when you speak to an endocrinologist, they tell you that you want the sugar to be as far as possible, a very flat type of sugar control. You don't want peaks and troughs. You don't want to suddenly peak up very high and come down very low. So you don't want a person to have suddenly very high sugars and the next moment they become hypoglycemic and all those things. So it's very important that anybody is taking diabetic medication to actually have proper meals and to have good control. So you see your doctor and get that sorted out.
Yeah. So that is important. Take your medicine. The important thing is to take your medicine, do not skip it. And so to our listener out there, so please take your medicine and don't skip it. Now, the next one is, this is one question I think, I think it's important. What is that one advice would you advise the younger self, your younger self, today? What is the one advice would you advise your younger self?
What would I have done differently? I think I don't know. Maybe enjoy life more. I suppose. I think as doctors, a lot of us don't spend a lot of time at work. A lot of us become we spend a lot of time at work. We don't spend enough time for ourselves. Don't spend enough time. I mean, hence come to mental health day, all these things. We don't spend enough time enjoying life. I think advice I would give myself is to enjoy life more, not to take things too seriously, and live life better. I think that's important.
That's good advice. Very good advice. Enjoy time, enjoy life more, you know. Now, tell us, doctor, if our patients and our audience want to see you, where can they find you?
I mean, I work in Sunway Medical Center, in PJ, in Bandar Sunway, and also in Sunway Velocity in Cheras.
Both Sunway Center, both of the hospital in Sunway.
But generally more in Sunway Medical Center.
In PJ, huh? So now, what is your bread and butter thing? What do you do the most? You do what I know, you do diabetic foot, you do vascular. What else? Tell us. Tell our patients, what do you do?
Basically, vascular surgeons deal a lot with what mainly peripheral vascular disease, which is diabetic foot and things like that. We also deal with dialysis access. Patients who need hemodialysis, they need the vascular access to do dialysis. We deal with that. A lot of varicose veins. Varicose veins are those big, ugly veins in the leg. So we treat that condition. Patients with aneurysms, and aneurysms are basically big bulging arteries in the abdomen or in the chest. When the artery becomes very dilated, and then there's a chance that it will rupture. So we deal with that also. Patients with strokes and who have got narrowing in the arteries in the neck, so we deal with that also. So any problem with any of the vessels are treated by vascular surgeons.
So Dr. Naresh do angio as well, but not the heart. Everywhere besides the heart.
we do angios of the leg. So patients who got like narrowing of the arteries in the leg, we do angios of the leg. We put in balloons, or sometimes stents if required, and things like that.
I think one of my clients came and see you for varicose veins, 60-year-old lady, and well, she's happy. She said my legs looks better now. Okay. No more fat varicose veins. But so if you want to see Dr. Naresh, please go to level 1 of Sunway Medical Center, which is Block A, right? The old building, huh?
Block B, Tower B.
Block B, the old building. Go to the Vascular Center and see Dr. Naresh. He's there, always ready to serve you. So Dr. Naresh is one of the nicest guy in the hospital. You know, people always tell us, I've not heard something bad from other people. Always a nice guy, always a senior doctor who's ready to teach the younger ones, and the younger ones loves you, you know. So if you want to see a doctor who listens, Dr. Naresh can listen to you and do. So one of the things that you do is also chemo pot, right? For cancer patient.
Access, which is pots. So anybody who need patients who need chemotherapy after any malignant conditioning cancers and things like that, we put pots, and that helps because then every time the person needs chemotherapy or even blood taking, they just puncture the pot rather than keep puncturing the vein and all.
Mm-hmm. If you need any service, if you need to bring your mother to do anything or your parents to do anything, please go and see Dr. Naresh at Sunway Medical Center, either Cheras or PJ. He's always there. Hey, thank you so much, Dr. Naresh. Thank you, brother, for coming up to the show. You know, it's amazing to see what you do and to know that, you know, that there is only 26 of you vascular surgeons in Malaysia.
About 20, almost close to 30 of us. So we always say we are, the vascular society, we always say we are 1 in a million. 30 million people in the population of the country, so we are 1 in a million.
1 in a million. There's only 30 of them in the whole country doing vascular surgery. Can you imagine that? They are the guys that do all the chemo pots and all the patients, and they are serving everybody, you know, on this. So so if you want to see a vascular surgeon, you need some help, please go and see him, doctor. And I just have to say one thing, just last thing. You still serve the government servant even you're in private. Now you still visit the government hospitals, right?
If needed, I still maintain my practicing rights with government hospitals. So when it's required of me to help out with the government side, I will help out. I'm still involved with some of the training bits with the government training side.
And you know, I mean, people out there do not know what does that mean. It means he is actually working with very little money for the government. It's actually national service. You know,
I mean, if it's required to serve the government, I mean, most of us would do it without any money. I mean, it's a service that we have to do. We will do it.
Just to make your friends happy, Senati Chong says, "Good afternoon, Dr. Naresh." There are a lot of friends, a lot of fans. People give you a lot of thumbs up. You know. The beauty of being a live show is that people can interact with you and they can say, how are you doing, you know. So thank you so much for coming out. We extended our show time a bit. We normally do 45 minutes. Today we are nearing an hour. But I'm so happy to have you, Dr. Naresh, to be up to the show. And it is my privilege, you know, to have you here. And I hope to see you more often to the show. Talk about other things, you know. Talk about cricket one day if we can. Talk about cricket. Right? One day if we can. And Dr. Naresh's wife is Dr. Shamila. And Dr. Shamila is asking you one question, you know, last minute or before you go. I have to take this. I cannot just, you know, let her go cold. She says, how has being a mixed heritage influenced your life? Dr. Naresh is a mixed parentage, a Chinese with Indian, right?
Yeah.
Your father is an Indian.
I was Indian, mom Chinese.
Mom is Chinese. So your wife is asking you this question. You have to answer.
Okay. Mixed parentage. You're comfortable with anything, like. It makes you a very open person. I mean, there's nothing. I mean, for one, I enjoy food. I enjoy Indian, whether it's Indian food or Chinese food. I enjoy everything. I enjoy Indian, Chinese, Malay food, anything. I enjoy food. But I mean, in the most serious note, actually, you are more open to a lot of things. You're not confined by anything. The bad thing about me is that my language skills are not very good. So, but I can understand Tamil. I can speak a little bit of Tamil. My mom's Hokkien, so most Hokkien words I can understand. If somebody's carrying out a conversation in Hokkien, I can understand whatever you're saying. So don't say anything bad about me. But otherwise, yeah. I mean, that's the thing about being a mixed parentage. You actually are more open to a lot of things, and you all cultures are good to you.
So there's something else. Andrew asked you to wrap this up. If you can introduce yourself in Mandarin.
Yeah. 我叫 Dr. Naresh.
But you're supposed to do. Yeah, go ahead.
Shoshu, I think I know. You're sure. Oh, what's vessel?
血管.
水管. Wiker, I think. Or 医生.
血管医生. Oh, fantastic. Now, your sister is pulling a leg on you. She says, speak in Hokkien.
No, that was a start.
You know, that's amazing. You know, mixed parentage in Hokkien, in Chinese, whatever. You know, thank you so much for coming up to the show. This is one of the most fun show I had.
It's a pleasure to be on the show. Thank you very much.
It's
great. It's an excellent experience to do this. Never done this before.
My wife is laughing all the way there. Watching us doing this. This is so much fun. Thank you so much for coming up, Dr. Naresh, and it has been a pleasure to serve your needs and serve you. I'm your insurance agent. It's my pleasure to serve your needs and serve your wife's needs. And thank you for serving the country. You've been serving the country for so many years and serving the people, and you are still serving the country and the people. up to today. You know, that is very good work. So thank you so much for coming up to the show. And so that's it, guys. 1 hour. We have to stop the show somewhere. I'll see you guys next week. Next week we will have an amazing couple that comes up to the show to talk about a creamy dream. Now, you might think differently. What is a creamy dream? These couples makes amazing cakes, and they are one of the best fine dining caterer in KL. So you have to see them why they actually pursue that dream of bakery and fine dining catering. Well, in fact, they are actually from very, very good family. They refused to go back to work for their parents, and they decided to start a business on their own. And that is an amazing story. So until next week, same time, 3 o'clock in Saturday afternoon, I'll see you again next week. This is Lim Ren En Live. See you next week.